coming together. I think the churches are a prime example. I call it a faith-based initiative. We see in McDowell County where that has come together, really working with the hospital with folks that come in and they don't have a resource there, and so they have volunteers to help connect with them to make sure they get to a doctor's appointment or go and shop for their groceries or whatever, just looking at the circumstances. So the community will need to come together and is coming together. And I think that a lot of the churches say this is who we are and what we do. And so we want to be able to work together. HIPAA made things a little bit difficult for hospitals and churches over time as we looked at privacy. But I think we kind of come full circle and there's a way for us to work through this. So to me, it's very important in having those conversations and really talking through that, because I think we have to align, and that is family. Your church family is something that can make a difference. Socialization makes a big difference in the health of folks and being a part of something bigger. So for us, that is important. We'll be happy to have that conversation with you from Mission, because we're looking at that as well, because we see in our counties where we have community hospitals, those communities are coming together and the churches are a big part of that. So we'd be happy to discuss it, NAMI as well. I think we're all working together in a line.
So before we get to the insurance piece, because that's the part that is really, actually Christina is really good at helping to explain this for folks, and so I treasure the fact that we have her as a resource. She is somebody who really knows this and has fought this for years. I'll give that for her in a minute. But we at NAMI actually have a FaithNet program, which is specifically designed to bring the faith community into the dialogue, because we believe that the faith community is one of the primary ways that we can eliminate stigma across different ethnicities, across different groups, folks who have felt underrepresented. The faith community becomes one of the first places that folks might say, this is what I'm living with. And so we would love to have our folks connect with you around FaithNet and the work that NAMI's doing with the faith community, because we really believe that is a big place for boots on the ground. So we would love to have more conversation with you about that.
My friends just told me that we are.
That's great. That's great.
Okay, great. That's wonderful. So,
well, Christina, after that problem.
And I don't know if my answer is going to be enough, but I'll just sort of say. So first of all, let's just be really clear, because sometimes people are confused about Smoky. We manage Medicaid and we manage a pot of state funding that we receive from the Division of Mental Health. So when you talk about private insurance companies and you're talking about pharmaceutical companies, that relationship is really directly with our providers. And what we have encouraged, and we see many of our larger, our comprehensive providers and some of the other providers, our outpatient therapists, who work very closely, they're seeing a variety of people who take insurance. What we hear from some of our providers is we don't see that the benefit package, it's very narrow. They'll only approve this much. We have to have this kind of certification. So I think that some of the providers who have come to us and asked us for assistance in advocating with the commercials. Now, I'll be very honest, we have to walk a very thin line. Some of this could be a conflict of interest for us. But what we are very interested in for the man or woman who doesn't have Medicaid, who does have some type of insurance, we even got into a situation just recently into a county. The provider came and said, we seem to have a lot of people with Humana, we have a lot of people with United. We are on their panels. They had done the work to have a relationship with those private insurance companies, and so they were able to work that out. But probably just the same they would say about us in Medicaid and state funding. The fees are the fees. People never get paid enough to do the difficult work. We do hear that most of the time that the payment, they do get paid in a timely way. There are concerns about that. The pharmaceutical companies, what I see is that the doctors have a lot of relationship with them. I don't feel that that is in a conflictual way. I think there's a lot of integrity with the pharmaceuticals. One thing that the pharmaceutical companies do that we see a lot, and I think the providers could talk to you about, is the free medications they give to a tremendous amount of people in North Carolina. So now, is there paperwork? Are there forms? Are there things you have to do? Yes, there are a lot of hoops, which goes back to this lady's point over here. What an individual who already has a very complicated life has to do, and somebody needs to help them. So I think there is always politics in this conversation around insurance. I think that we see in our legislation that was passed last year that we know that the commercials are going to have a greater presence in North Carolina. We are really trying to learn about those, how they do their business, how we do their business, what their expertise is, how much they pay, are we in alignment with treatment of people. So I don't know if I'm specifically answering your question, but I think that we are in a relationship with a variety of insurance companies, even though we don't specifically deal with it. but we are an advocate for our providers and ultimately the person who needs to get care regardless of the insurance they